Hey y'all, hey, welcome back to Retta's World. So today on Retta's World, we're going to talk about how to use a bag valve mask. Yes, a bag valve mask. What is a bag valve mask, you ask? It is this here. This is a bag valve mask. They come in for adults and they also come in children's size as well, which we will show you in a later video. So with this one here, this is an adult bag valve mask. You can use it for adult or a child. Okay, so with the bag valve mask, we typically only use it when you have a two-person scenario, meaning there is two people resuscitating someone in a CPR situation. But for today's purposes, we're just showing you how to actually use the bag valve mask, okay? So with the bag valve mask, the triangular portion here will go to the nape of your nose. At the top of your nose is the nape. So it will go to the nape of the nose, okay? So you'll place it on the nape of the nose, and we'll do something called an EC clamp technique. So these two fingers will make a C. These three fingers here will make an E, which will actually allow us to seal our mask with the C, and the three fingers that make an E, it opens our airway, okay? So we're gonna place our bag valve mask on the person. We're gonna seal it with our C. We're gonna use our E to lift the chin and do a head tilt chin lift, because that's the only way we're gonna be able to allow air to go through. Is you have to have the airway open. If the airway is still down like this and we give a breath, we will not see chest rise. See, no chest rise, okay? Now, if I seal it with my C, use my three fingers, the E, to open the airway, and I give my breath, we see chest rise, because now we're doing it the correct way. You see chest rise every time you do it. See chest rise, okay? So basically, that is how you use the bag valve mask. You put the bag valve mask at the nape of the nose. Use your EC clamp technique. Your C seals it. Your E opens your airway, and you give your two breaths. So basically, you'll be giving two breaths. So let's give two breaths. 1, 2. And we don't have to squeeze the whole bag until we see the chest rise like that. We can squeeze it enough just until we see a little chest rise. Once we see a little chest rise, we know that the air is getting in there. We don't want to give them too much air. So when they come to, they may vomit because we've given them too much air. So we want to make sure we give them just enough air to get the chest rise, okay? Once we see that little chest rise, then we know that we've given them enough air. And this is the proper way to use the bag valve mask. Again, remember, using the bag valve mask, we typically use it in a two-person scenario. We don't usually use it when it's just us by ourselves providing CPR to someone. You typically use it when you have two people. This video is just to show you how to actually use the bag valve mask, okay? So don't get confused. We'll show you a later video on us actually doing a two-person scenario where we're using the bag valve mask. One person is using the bag valve mask and the other one will give compressions, which will be the proper way to use it. This video is just to show you how to actually use the bag valve mask. All right, thank you all for watching. Don't forget, hit that subscribe button so that way you don't miss any of our videos and you're able to get notification once we post videos. Don't forget to like and subscribe. Bye.